very much. On to Senator Martin.
Chair, thank you very much for your presentations today. I've been listening carefully and to questions that have been posed by my colleagues, and just I'm not a scientist, I'm not a medical professional, but we did hear that there's been about 30 years of data, collected regarding cannabis use. It's not the kind of fulsome data that you're referring to that we will get once legalization occurs. But as a 21-year educator, I know I have anecdotal examples of what the effects of cannabis can be on youth. Mr. Culbert, you said we have to be careful. I absolutely agree with you. And Dr. Granger, you were talking about if Canada is to be a model for the world, and that the last 5 years of evidence of legalization in other jurisdictions is quote unquote meaningless in terms of there's going to be trial and error, and we're still trying to understand this. If we are to be a model to the world, based on what we even heard today, knowing what we know about what the effects of cannabis is on youth from 18 to 25, the effects on impaired driving, because that's another bill, C-46, and I know that we're not ready as a country. I'm just wondering, we know that this is needed for various reasons, but are we ready now? Is this the time? Should we be taking a little bit of time to ensure that the impaired driving law and implementation is going to be ready, combined with C-45, knowing what we already do we need to just be more prepared, and so that whether it's this summer or this fall is too soon for this law? So I'm curious to hear from the panel on your response to that, because it's just based on everything I'm hearing. I'm just so torn and really worried about using our youth and young adults as the test subjects to collect this data that we need. I just don't think we're ready yet, but I'd love to hear your response.
Okay, well, we'll get a response from everybody then. You've invited them, and we'll start with Mr. Culbert.
I could spend an hour on this, but I won't. Cannabis is ubiquitous in our society already. In the 80s, if you were a young person in the 80s, you probably smoked cannabis. We have a lot of experience with this already. To delay legalization is really just a stopgap of allowing us to do the more positive work. As far as things like impaired driving, 13 years ago, the Canadian Public Health Association launched a pot and driving campaign focused developing resources for adults to have conversations with youth. We just relaunched it 2 weeks ago, updated the data. A lot of things are going on. As provinces, as D-Day comes closer, provinces and territories have to do their education campaigns to the public. Education meaning, what's the law in our province and territory? And that's going to require like high saturation, television, radio, social media, you name it. They're all over it. The health promotion campaigns, which empowers people to make healthy choices, are ongoing, and they will continue to ramp up. We're developing all of those resources now. I believe we are ready, and that to delay simply delays the positive work that we can do that is required under a legalized framework.
I'm just going to do one supplementary, and then I'd like to hear from perhaps Dr. Campbell.
Well, sure, it's your time.
Well, we're hearing from RCMP that they are not quite ready, especially when it comes to impaired driving. There needs to be more trained individuals to do that. In terms of health education, we're talking about still developing versus the education that should have started last year. So I just wanted to, we're hearing different, facts from various stakeholders and municipalities who haven't yet been fully consulted. So I guess that's a comment to you, Mr. Culbert, but I'd like to hear from Dr. Campbell, actually, on this question.
Dr. Campbell.
Thank you. I would just like to point out of interest the latest research for medical uses, the guidelines for its use. So as a family physician, if someone comes in with refractory nausea or vomiting from chemotherapy, spasticity from multiple sclerosis, or last line for neuropathic or nerve pain, which is a very specific type of pain. There is strong evidence for it. Otherwise, in a lot of cases, there's actually evidence against it, as there's shown to be a strong and consistent association with mood and anxiety disorders. Basically, my whole career is based around the best evidence and best care for the patients, and knowing what I know as a family doctor, I would use medical marijuana for those three purposes, and for other areas in pain and such, I would use other medicines that we have available or non-medicines.
Okay, thank you very much. Move on to